How does it feel like to be a doctor in Canada? Today is Canada Day, and in some parts of the world is also celebrated as Doctor's Day. And since I'm a doctor in Canada, just thought I'd share my experience with you. So I've been in Canada for about 10 years now. I'm an immigrant here. Prior to that, I lived and worked in England for 15 years. And prior to that, I was in India. Overall, I think the Canadian system is a very good system. When you have a publicly funded system, there are going to be limitations. But the way the system has been designed is, I feel, superior to these other systems that we're comparing today to. The British system was a very bureaucratic, clunky, and inflexible system. And certainly I felt that there were way too many middle managers within the NHS, CCGs, and all these governing bodies, while there weren't as many boots on the ground in that system. The American system and the Indian system are kind of similar, very much private pay, insurance pay based systems, which tends to inflate the cost and lead to inequities. But the benefit, I guess, is that not only do you get your needs catered to, you get your wants catered to as well. A system like the Canadian system is really geared for needs, not wants. To all those people who had to wait 10 hours at emergency room because your child has a sniffle, consider whether you really should have been at the emergency room for that in the first place. And before you criticize the Canadian medical system, perhaps find out about the experience of those cancer patients receiving treatment at Princess Margaret free of cost that would have otherwise costed them thousands and thousands of dollars. Personally, I feel the Canadian system is the best. Certainly there are things which can be improved. As an example, if I want to get my clients an MRI scan or a consult with a surgical specialist, it would be nice to get a centralized website where I could see their relative waiting times. It would really help in management if those waiting times could be advertised, available for the public to see, so we could plan things accordingly. But apart from those kinds of niggles and perpetual staffing and workforce challenges, which is quite normal in any system, which is more really related to supply and demand, immigration laws, the ease with which foreign graduates are able to get recognized locally. If these things could be evened out, and I do believe that the current government has the intention of doing this, then we can make a good system even better. So yeah, overall, feel free to share your experience with the Canadian health system. But as a physician, at least compared to other health systems like England, United States, and India, I feel this is the best balance, being a public funded system that it is. Look forward to seeing your comments. Take care. Happy Canada Day and happy Doctor's Day as well.